Febrile seizures. What are they? Why do they happen? What age groups do they affect? As a parent, what are the steps that you need to take when your child has one? What information does your doctor absolutely need to know, and what tests are going to be run? And what are the chances that your child is going to have another febrile seizure in the future? Those are all very important questions, and I'm going to answer all of them in this video. I'm Dr. Owens, and this is Who's Your MD? Let's get started. A seizure is simply abnormal electrical activity within the brain that sometimes presents as a convulsion. That's uncoordinated muscle contractions in the body. Muscles involved are often those of the legs, arms, jaw, eyes. That's why when people describe seizures, they'll often say, somebody bit their tongue or their eyes rolled back. The person can't control their muscle movements. Seizures are highly variable in how they present. Sometimes you can see all of these things or none of them at all. Sometimes people just aren't responding to you, or they're drooling or staring off into space. And so they're really highly variable in how they present. Now, a febrile seizure occurs in the setting of a fever. That's a temperature, most doctors agree, is greater than 100.4 degrees Fahrenheit or 38 degrees Celsius. Febrile seizures occur in children aged 6 months to 5 years old. In the past, I've worked with pediatric neurologists who really consider that upper age limit to be 6 years old. And so when thinking about these, think of 6 months to 6 years old. Within that age range, 12 to 16 months is the peak incidence. These are so common that 1 in 25 kids will have one. If you think about a school and a classroom, that's one kid in every classroom who's had a febrile seizure. It's very common. And in fact, there's certain ethnicities that experience them at higher rates than others. People from Japan, people from India. But big picture is they're common all over the world from people from all backgrounds. So why do these occur? Well, the cause are the things that cause fever, right? And so that's infections. Number one being viral infections. Things like upper respiratory tract infections. Viruses like rhinovirus, adenovirus, a whole host of them. And really, they're not too special either. And so kids get sick all the time with these bugs. In fact, in the first year of life, kids on average will have about 13 unique infections. If they go to daycare, that's sometimes more. Kids are getting sick all the time, and these can set up kids to have these. Bacterial infections too, especially bacterial ear infections, can set them off. Another thing to consider too is a recent vaccination. A lot of times when you go to a pediatrician, your child gets a shot, they'll say, hey, watch out for the next 24 hours, there's a risk, you could have a little bit of a fever. It's that fever can also set off a seizure as well. Not always by any means, but something to keep note of if a recent vaccination was done. And there's a lot of debate too about, is it how high the fever goes, or is it how fast it got there? These fevers of 102 to 103 degrees tend to cause the seizures more, but it's still not quite fully understood about how all this works and why. If a fever rises really quickly and gets to a high temperature, it's probably more likely to cause a seizure, but like I said, there's still a lot of debate. What is known is that there's a strong genetic component behind all of this. And if there's a strong family history, then that means that your child might be predisposed to having them. It is important to note that these often occur within the first 24 hours of an illness. If a child has been sick for 4 or 5 days and then all of a sudden has a seizure, I would consider that a more serious red flag. So when febrile seizures do happen, it will be the most terrifying experience of your life as a parent, grandparent, daycare worker, babysitter. It's a totally normal reaction. I can tell you that even doctors with medical training and everything, whenever they have kids with febrile seizures, they panic, and that training kind of goes out the window. With that being said, here are 6 steps that you need to take whenever your child has a seizure. Number 1, put the child on the ground. During a seizure, they're going to have uncoordinated and uncontrolled muscle contractions and movements. If they're sitting in a high chair or on a couch, this could be very dangerous. They can injure themselves in nearby objects. They could fall off of that chair or whatever and fall on the ground and hurt themselves even more. So you need to take them, put them on the ground, away from any objects, preferably on carpet or a blanket. And then on the ground, you want to turn them on their side a little bit. That's to ensure if they're drooling or if they vomit, that leaves the mouth instead of going backwards into their airway, called aspiration. Number 2, look in their mouth. So if they were just eating or they have a bottle in their mouth, make sure the bottle is taken out immediately. If you see a large bite of food, quickly take your finger and try to swipe that out of there, only if it's really obvious. Number 3, call for help. Call 911 if this has never happened before. Have somebody else do it preferably. Really as simple as that. Number 4, take note of the time. After you've done steps 1 through 3, you need to glance up at a clock, look at your phone, take note of the time that it started, and then you need to see how long the seizure lasts. A seizure will end, the child will close their eyes, take a nice big deep breath, and then the abnormal limb movements of the arms and legs will stop. Keep note of how many minutes that lasts. That's a very important information for your doctor to know. Number 5, take note of movements. Are they moving abnormally on both sides of their body or only half of their body? That's incredibly important information too that your doctor needs to know, and I'll explain why later. Number 6, don't try to hold them down. A lot of times once you've gotten through the first steps, you'll see the child, having these kind of rhythmic jerking motions of their arms and legs, and it's very unsettling to watch. And you feel like you need to be doing something. But you do not need to hold them down or prevent those movements from happening. Those in and of themselves are not harmful. Holding them down and restricting that movement is not going to help at all. Finally, a bonus tip, pull out your phone and take a video or have somebody else do it. That's going to do a lot of things. So it's going to give you video for your doctor to determine if it is a seizure or not, or it's just something that's mimicking a seizure. It's going to let them see the movements, whether they were both sides of the body or not. That checks off step number 5. And then it's going to give a timestamp. All right, that's going to check off step number 4 of how long the seizure is lasting. It's important to note that after a seizure ends, right, they close their eyes, take a nice big deep breath, and you don't see those movements anymore, that there's a phase called a post-ictal state where they might feel really tired, groggy, confused, and is really out of it. That's totally normal. Usually lasts around 30 minutes, even up to an hour before they start to slowly kind of go back to normal. I mention that because it gives some people a lot of concern. They see them doing these movements and all of a sudden now they're not moving at all and they're just really out of it. Totally normal, like I said, just something to keep note of. When you get to the hospital, doctors are going to have a lot of questions for you. Whether they ask or not, you need to mention the following things to them. First, always mention the child's birth history. Were they born at term? Were they born premature? Were there any complications or any intensive care unit stays required? Mention any diagnosed medical conditions, any medications that they take, or vitamins, herbs, supplements that you're giving them, allergies, past surgeries, recent traumas, falls, or accidents. So getting a head injury can actually cause a seizure. Very important to mention that. Any possibility that they got into any substances or exposures, any open pill bottles or any access to any chemicals that they could have gotten into. Recent illnesses, of course, fever, cough, runny nose, or any sick contacts at home, any sicknesses going around. Any histories of seizures before, or even febrile seizures, or any family history of any neurologic disease. And like I mentioned before, any recent vaccinations are important to mention. Next is the time where you need to show the video if you have it, or describe the duration and the movements. This is important because this information is used to classify the seizure as simple or complex. So a simple febrile seizure only occurs one time in a 24-hour span, affects both sides of the body, and doesn't last longer than 15 minutes. As opposed to that, a seizure can be classified as complex if it lasted longer than 15 minutes, only affected one half of the body, or even one arm or one leg, or occurred more than once in a 24-hour span. The reason that is important is it helps predict the future of whether they're going to happen again or not, and I'll explain a little bit more of that later. So once your doctor takes in this information, they're going to perform a physical exam, a thorough neurologic exam, and then they're going to decide the next steps that need to be taken. There are a lot of tests that can be done. Some basic things include blood testing, urine testing, and if there's a suspicion that something else could be going on, then your doctor could choose to do cerebrospinal fluid testing or a spinal tap. where they look at the fluid in the spine to see if there's infection. There can also be imaging of the brain via a CAT scan or MRI. There can also be EEG testing where they look at the brain waves. That's via a little hat that they'll put on your child that has little electrodes. Sometimes they will even opt to do that for 24 hours. They'll bring in a camera, keep the hat on, and they'll even give parents a button to hit. And if they notice anything abnormal, you hit the button, and it gives kind of a timestamp for doctors to look during that period and see if they see any we call epileptic activity or seizure-like activity. It is important to note none of that testing is actually required to make the diagnosis of a febrile seizure because it is a clinical diagnosis, meaning it can be done with a thorough history and physical exam. No testing has to be done. However, sometimes, blood and urine testing can be done, especially, you can look at urine, you can do drug testing, you can look for signs of infection via like a urinary tract infection, because kids often can't verbalize those types of symptoms like adults can. And then, basic blood testing can look at their, complete blood counts and metabolic profile and things like that. If there's other concerns of, something else going on or another type of infection or intracranial abnormality, if there's concern for trauma recently, then you can opt to do those other things. But, don't be surprised if actually even none of that is done. You don't need any testing. It's a clinical diagnosis. In the past, when I have cared for patients with febrile seizures, the number one question that I get from families is, what are the chances that this is going to happen again? And that is a very good question, and that's why the steps that I told you to take are so important, because knowing whether this was complex or simple makes all the difference in determining the chances of it happening again. If it was just a simple febrile seizure, which is 80% of all febrile seizures, by the way, then the chances of your child having another one by the time they start kindergarten is about 33%. For complex, it's about 50%. And so, decent chances of them actually having another one. But what about the chances of having seizures like ongoing the rest of their life beyond the age of 5 or 6? That's something called epilepsy. The risk in the general population of having epilepsy is about 1%. For somebody who's had a simple febrile seizure, that risk is about 2%, so it's more. And for complex, it's 4%. So yes, increased risk, but still 2% and 4%, there's still 96 to 98% chance that they are not going to have seizures ongoing forever. Big picture, will they have another one? Yeah, possibly so, but after the age of, kindergarten age, 5 or 6, they're probably going to outgrow them, and it's not going to be a big deal going forward the rest of their life after that point. For, all the parents watching who are watching this after a child just had one of these seizures, you can feel, rest assured, it's a very common thing, and yes, it's possible to have one again, but probably not, especially if it was simple. And then the chances of them, outgrowing them are really high. They're probably going to outgrow them. It's not going to be a big deal. And it's not going to affect their growth or development. And they're going to be just fine. Hopefully this was very helpful for everyone that watched. Please share this video with other parents, grandparents, babysitters. Share this with your child's daycare. Have everyone watch this and know what to expect, because this is so common. It's actually the #1 neurologic disorder of infants and young children. If you liked this video, please hit the like button, share this video like I said, subscribe to my channel. By doing those things, it helps grow my channel and helps YouTube recommend this to others if you found it helpful as well. I'm Dr. Owens, and this is Who's Your MD. I'll see you at the next video.